Delicious news. The McDonald's meals you love are now starting at $9.99 every day. Grab your faves like the McChicken, Big Mac, 6-piece McNuggets, or Filet-O-Fish with medium fries and a medium fountain drink starting at $9.99 each plus tax. At participating McDonald's restaurants in Canada, prices exclude delivery.
Welcome to Power Play. I'm Evan Solomon. On our program today, a state of emergency in Ontario, but are the new rules enough?
The system is on the brink of collapse. It's on the brink of being overwhelmed. We're at levels we've never seen before.
With a second wave threatening to overwhelm hospitals, Doug Ford declares a stay-at-home order. But why are so many activities still allowed? Why was there no extra help for long-term care homes where more deaths are predicted in the second wave than the first? How will all this be enforced? We asked for multiple Ontario government ministers today. None were made available, but our Queen's Park Bureau Chief, Colin DeMello, will join us to break down the details. Ontario Liberal leader Stephen Del Duca will also be here, and so will CTV infectious disease specialist Dr. Abdu Sharkawi. He practices in Ontario. He's not impressed. Did the province get it right? Then, Justin Trudeau shuffles his cabinet. Is he readying for a pre-election team?
From the very beginning of any minority parliament, every political party understands elections can happen. But as I've been consistently saying, we don't want an election.
Well, everybody says that, but are they preparing for one? The industry minister, Navdeep Bains, has just left politics. That prompted the mini-shuffle today. Mark Garneau becomes the new Foreign Affairs Minister. François-Philippe Champagne becomes the new Industry and Innovation Minister. Omar El Gabra rockets into Cabinet as the Transport Minister. The Prime Minister welcomes back Jim Carr to Cabinet. Good to see him back, by the way, after a medical leave for cancer. Is the Prime Minister getting his team ready for a pandemic election battle this year? We'll speak to the departing Minister, Navdeep Bains, who caused the shuffle. Then Dr. Isaac Bogosh will join us on the COVID crisis and how it spun out of control and why it could get much worse. Lots on the program today. It's Power Play. Let's get to the players. The system is on the brink of collapse. The very dangerous UK strain of COVID is here and could soon overwhelm ICUs in Ontario. Those are just part of the stark warnings today from the Ontario Premier Doug Ford as he declared a state of emergency and a stay-at-home order for 28 days. As of Thursday at 12:01 a.m., that order will require residents only to leave their homes for essential purposes, getting groceries, medical appointments, or essential work. But it's actually a lot more confusing than that. Outdoor gatherings are still allowed, but limited to 5 people, just in your home or elsewhere. Is that essential? Are outdoor rinks still open? Apparently, yes. So we're going to clarify what all this means. Meantime, new COVID modeling numbers revealed a stark picture. By February, in a worst-case scenario, more people could die in long-term care homes in Ontario than died in the first wave. That raises the question, why was no new funding announced for long-term care homes today? And why was there no announcement of, say, a sick leave? There were details on enforcement, those. If you're found in violation of these rules, and they're hard to understand, you could face a hefty fine or even, get this, up to a year in jail, according to the Solicitor General. To break it all down, CTV News Queen's Park Bureau Chief Colin DeMello joins us. Colin, great to have you here. Man, first of all, let's just start with the stay-at-home order and the state of emergency. What are the key differences from where we are today to what's coming?
So, the state of emergency, there is a massive difference, Evan, between what happened back in March and what happened today. Right back in March, the entire economy was brought to a grinding halt. Now, wide swaths of the economy are still allowed to open, despite the fact that Ontario is now theoretically in another state of emergency. The state of emergency, though, is simply the power that gives the Premier additional powers, right? The legal justification to enforce that stay-at-home order, because people are being asked not to leave their house unless they have to go out for essential purposes. And an essential purpose is defined as going to the grocery store, the doctor's office, the pharmacy, going to work if you are an essential employee as deemed by your workplace. And finally, going outside for exercise as well. And so the question is, how are they going to enforce something like this? Well, they're relying on the Ontario Provincial Police, all of the police officers across this province, and of course, local bylaw enforcement officers as well. They will have the power to basically stop people on the street and say, where are you going? And why are you outside of your house? And if you tell them, I'm going to X place for X purpose, and they deem that to be okay, you'll be allowed to go along your way. But if the police officer, at their discretion, I've been told, deems that you're perhaps not telling the truth, you could be facing a ticket, maybe even up to a year in jail. So there was a lot of nuance and a lot of gray area there.
A year in jail?
Yeah. And frankly, a lot of power for police.
Colin, just a couple things. I'm just trying to figure it out. Outdoor rinks are open. So my kid can cross the street and go play hockey. And actually, you're allowed to be with 5 people. So if you and I decide to go for a run with 2 buddies, there's 4 of us. Are we allowed to do that? I don't really understand. Can we be stopped and say you're all in different households, even though there's 4 of you? What is it?
There are a lot of confusing elements to this, right? Like outdoor shooting ranges are open. Pickleball courts are open. Tennis courts would be open. You'd be able to go to a BMX bike park as an example. And, typically young people aren't going to a bike park or a skate park alone. They'd be going with friends. So, are there going to be enforcement officers basically hiding in the bushes at every corner waiting for you to kind of hand you a ticket? We simply do not know. And frankly, some of my colleagues here at Queen's Park are also hearing that the province actually hasn't written the entire legal orders here, that they're preparing these in time for 12:01 on Thursday. So there is still a lot of questions around exactly how this is going to work. Keep in mind as well, Evan, that a lot of parents are going to be at home with their children in Toronto, Peel, Windsor, York Region, and Hamilton because schools are going to be closed until early February. So what does that mean for people who are working at home with 2 children? Can they rely on their grandparents for childcare? And that, too, is a big question mark. And we're also being told that people who have a secondary home like a cottage, they can go to their secondary home. So, there's a lot of confusion here. And I'll add one more thing to this. The pandemic is affecting different area codes very differently. Rosedale versus Jane and Finch, as an example, in Toronto, a high-income area where people can socially distance, where they have place in their home to separate. COVID-19 isn't spreading there like it is in lower-income areas where people are living in densely populated homes. Right. Are the police going to be increasing enforcement in one area code versus another? A lot of questions still to be answered.
And just real quick, Colin, the other thing is businesses. You got big box stores are allowed to open, but the Premier says he's gonna crack down on them like the 800-pound gorilla if they have too many people in or have too long lines. But small businesses can't open. How's the business community reacting to this?
Yeah, well, again, there's an inequity here, right? A lot of retailers in this province are being told you have to operate only within the hours of 7 a.m. and 8 p.m., and you have to close after that. But big box stores, grocery stores, convenience stores, Shoppers Drug Mart and Rexall and gas stations are allowed to operate outside of those bounds. Restaurants, too, would also be allowed to open for delivery or takeout. So if you're a small business owner, this is actually going to look like a slap in the face because Walmart would be able to open from 6 a.m. until 11 p.m. Some grocery stores could open up 24 hours. And so what the Premier is talking about when he talks about enforcement is going into those big box stores, they're only allowed to open at 25% capacity. And if they catch more people in there than are allowed, then they're going to crack down on them, like the Premier says, an 800-pound gorilla. And I should mention just on that, gorillas, a max weight is 600 pounds. So,
yeah, so it's going to be a big gorilla. Just the other thing, and I appreciate what you're talking about, Colin. But then you say restaurants are open. So if the police say, where are you going? I'm going to pick up a burger. Is that essential? It's not groceries. I don't know. All right, Colin, great work breaking this down. There's lots of questions, and I really appreciate you joining us. Thanks, Colin. Now, that announcement prompted us to ask for the Minister of Health, the Premier. Nobody from the government was available. But how has the opposition reacted to that in the province of Ontario? Do they support these measures? Let's find out. Joining me now is the leader of the Ontario Liberal Party, Stephen Del Duca. Mr. Del Duca, thank you for jumping in. What do you make of this state of emergency and the stay-at-home orders? Is this enough to bend a very scary curve?
Yeah, look, the numbers are horrifying, and I think people right across this province are very, very scared. And, I think they're also, as I am, completely fed up with the incompetent and unclear platitudes that Doug Ford keeps delivering instead of real leadership. So, it's so confusing. People don't understand what they're supposed to do. We still don't have a plan to deal with nursing homes properly and the people living there. The vaccine rollout's been really incompetent. The list just goes on. It's really, really shocking and disappointing.
The other thing is the modeling that I've just spoken about earlier is predicting potentially, in a worst case scenario, by February, more deaths in the long-term care homes in the second wave than the first wave. Yet there was no extra funding for long-term care homes. What was missing, in your view, from the announcement today?
Well, I think a few things. You point out nursing homes. I think something like 40% of Ontario's nursing homes have outbreaks. We see the tragic deaths. And, to be clear, we've known since at least last May, when the Canadian Armed Forces put out their report, if not before that there were tragic things happening in those nursing homes. Why we still don't have a real plan, why the vaccine's not being rolled out efficiently in those nursing homes, why we don't have the Canadian military being called upon to come back in and help at this point, which I urged Doug Ford to do days ago, is beyond me. It's incomprehensible that they can continue to screw this up as badly as they have. But today is another example of Doug Ford's incompetence in the face of the second wave of this pandemic.
But what should he have done in your mind? Do you think he should have just gone further and have a total shutdown?
No, look, I think there's certain things that he could have done. So number one, I don't understand why he continues to delay making hard decisions. Even the announcement today doesn't take effect for 2 more days. Before Christmas, we know that for 5 days, he said there was a lockdown coming. Cell phone data shows that in those 5 days, while Doug Ford dithered and delayed, things got dramatically worse. We're all paying the price for that now. Delays again last week when he said the numbers would be scary. And yet he seemed to take the weekend off in terms of delivering that news clearly to the people of Ontario. So, number one, stop the delays, be more decisive and move more decisively and more swiftly to deliver the news to the people of Ontario. Paid sick leave. We've been calling on Doug Ford to deliver paid sick leave, particularly for essential workers, for months, and he's continued to ignore those calls. I already mentioned calling in the military to help deal with the vaccine rollout, particularly in nursing homes. And lastly, there is absolutely no reason that big box stores should be able to continue selling non-essential goods in the face of the numbers that we've seen. Those are just some examples of the kind of leadership we needed today that we did not get from Doug Ford.
I got about 30 seconds here, Mr. Del Duca. The Solicitor General said there'll be heavy-duty enforcement at the police discretion. You can go to jail for up to a year. That is a heavy, heavy hand. I don't know what is the violation that could cause you to be eligible for jail time for up to a year. Do you know?
Yeah, no, I don't know. I don't think any Ontarian knows. And enforcement is fine. In fact, it's important. But when the government's confirming or conveying very confusing information, it puts an unfair onus on the people of Ontario to understand the rules that they might be held accountable for breaking. So again, clarity, coherence from Doug Ford would be a welcome change.
Stephen Del Duca, Ontario Liberal leader, I appreciate you joining us on the state of emergency in Ontario and the stay-at-home order. All right, so there's lots of politics around that. And while Ontario brings in those new measures, well, the federal government, they're trying to deal with the supply issue. Is there enough vaccine? After all, if we had a vaccine, we wouldn't need a curfew. We wouldn't need a lockdown. We wouldn't need to go through all that. But we don't have enough, so we're dealing with it. To be fair, so is the rest of the world. So the federal government had some news today for Canadians. Canada has now secured 20 million more Pfizer doses. Those additional doses are set to start arriving between April and May. Okay, so this is interesting. The government has overperformed on the volume side. In other words, we will have more vaccines per capita than any other country. And so that really means that by September, most Canadians should be able to be vaccinated. The problem is we're underperforming on the speed. This will not impact you this month, next month, the month after. In other words, the long, hard winter with lockdowns and curfews and the new strain of COVID will not be impacted by those 20 million. So you have to distinguish between volume and speed. So in order to deal with that before we get the vaccine, are these new measures in places like Ontario or the curfew in Quebec enough? I want to bring in the CTV News infectious disease specialist, Dr. Abdu Sharkawi. Great to see you, Doc, and we always appreciate your work. I want to start in Ontario. Let me actually start with this additional Pfizer doses. They're coming, good volume. Is it fast enough, in your view? Will it change the trajectory of our vaccination program?
Well, it adds some buffer, hopefully, to a vaccine that we know is effective and seems quite safe. And there's good data to back that up from what we've seen from what was released from the CDC not all that long ago. And, it's better to deal with something that you know and have had some experience with and evidence to base your policy decisions are. So from that point of view, that's certainly favorable. Unfortunately, as you aptly mentioned, that's 3 months away. There's a lot that can still happen between now and then. It places additional pressure on everybody to adhere to public health measures. We're in the throes of a very bad second wave that doesn't appear to be anywhere near its peak. And so we've got a lot of other hard decisions to make and a lot of other policies to hopefully enact to help people abide by those public health measures. And that is not going to be a small task.
You practice in Ontario, and you tweeted this out after the announcement today from Doug Ford. What exactly is the difference, you wrote, between a curfew and a stay-at-home order? Where is the ramp up for testing, paid sick leave, isolation facilities for hardest-hit communities? I wish we did more that was action and not optics-driven. So you clearly weren't that impressed with today's announcement.
No, I wasn't, frankly. I think that when you look at this from afar, it looks like we're creating a sterner environment and we're creating some sense of deterrence to sort of shock people into coherence and understanding that they will be at risk for being fined or potentially even jailed. Frankly, I don't know that that really has much teeth. We saw more than enough evidence of people clearly violating rules when it came to gathering in the first wave. And next to nothing was done about it. I think we can count on less than one hand how many times people were actually fined. So frankly, I don't think that this is much of anything besides a paper tiger. We talked about all the inequities of what's happening with businesses that are open and closed and what's being sold that's essential versus non-essential. But I think my second point there is really what disappoints me the most. I think the root causes are not really being addressed here. There are a lot of people who are trying to do their best. It's not reckless or irresponsible behavior. They are stuck in a very bad situation from a social, an economic, and a work standpoint. And I don't know how a state of emergency with the threat of fines or a stay-at-home order helps those people at all. So we need tangible efforts with mobile testing units, with culturally relevant community and faith leaders to be engaged, paid sick leave for people to not worry about losing their job so that they can actually go and take time off and get tested, and isolation facilities so that they don't have to stay home with 6 to 10 other people, as is the case in many of these communities, multi-generational households, and that's how COVID spreads. This isn't rocket science, but we've got to make some tangible steps towards helping these people and supporting them. And thus far, I've seen none of that happening.
Powerful comments on that, Doc. Hey, before I let you go, the modeling numbers in Ontario, top doctors warn those numbers could lead people like you having to make tough decisions. Who will get oxygen? Who will not? Here's what I think we got this clip of Dr. Steiny Brown saying this. Check this out.
As we climb closer to 1,000 intensive care beds, about half of our capacity, filled with COVID-19 patients in February, we will have to confront choices that no doctor ever wants to make and no family ever wants to hear. They will be choices about who will get the care they need and who will not. There will be choices about who receives oxygen or is transported to hospital.
Pretty grim. Just real quick, Doc, there's a threat that the system could be overwhelmed. How close to the line are you right now?
We're flirting with it, and we've seen enough evidence from places that are really stretched and have been in dire straits now for some time. And it's only a matter of time before the rest of us can't cope. We can't be the safety valve indefinitely. So I don't want to see Toronto and Ottawa and Montreal turn into, Lombardo, Italy, or New York City. That keeps me up at night, and it's terrifying.
Dr. Sharkawi, thanks for your work and thanks for your warning. I always appreciate it, and I know our viewers do. That is Dr. Abdu Sharkawi. Now, we got to take a break, but coming up, we go to the other big story of the day in politics. Are the Liberals shuffling their cabinet to prepare for an election this year? We'll chat with the minister who caused the shakeup, Navdeep Bains, next. Stay with us.
I believe very, very strongly that no bilateral relationship is more important than that of Canada with the United States.
I hope to help the Prime Minister and my cabinet colleagues reach out to the West.
All right, those are some of the new faces, well, the old faces, but in new roles of the new cabinet. This is all the domino effect of one simple walk in the snow. Sources told me last week that the Innovation Minister, Navdeep Bains, last week took the proverbial walk in the snow with the Prime Minister and said, I'm retiring from politics. Now, remember, this is a guy who was the co-chair of the 2015 Liberal election campaign, a powerful minister, especially in the crucial 905 ring around Toronto, and he leaves a big hole to fill. And fill it, the Prime Minister did today with his cabinet shuffle. So let me just quickly tell you who's where. Francois-Philippe Champagne leaves his job as Foreign Affairs Minister after only about 14 months and becomes the new Innovation, Science and Industry Minister. Mark Garneau, who you just saw, leaves the transport file, gets in his political rocket and goes over to the Foreign Affairs file. Omar El Gabra, who was previously the Prime Minister's parliamentary secretary, you may not know him, he's an engineer and an MBA. He gets into cabinet as the new transportation minister, and there's a face that you probably do know, Jim Carr, the former natural resources minister, is back in cabinet after he stepped aside for cancer treatment. We're glad he's healthy again. He's now back as the minister without portfolio, but the special representative for the prairies. Now, all this is coming in a backdrop against a looming federal election campaign expected this year, spring or fall. The timing will depend on the vaccine process and the opposition. Are they willing to take down a government, likely over a budget? So are the Liberals getting their new deck, their new team in place? Let's find out why Navdeep Bains leaves. He joins me now. First of all, great to have you back on the program. I say this to anybody who served so long or served our country in any way. Thank you for the service. It's a hard job, whatever political stripe you wear. But why did you decide to leave in the middle of a pandemic? You're only 43. You're a powerful minister. Why now?
17 years. I've been 17 years. I've been in politics, 6 campaigns. And when I talk to my daughters who are in grade 8 and grade 5, and Nanki, who's 13 years old, gave a very clear illustration of what the future may look like if I continue in politics. She said, Dad, look, if you run again and you win again, by the time you're done with politics, I'll be off to university. And that resonated with me. I realized that over the past number of years, I've missed birthdays, I've missed parent-teacher interviews, dance recitals, and it became clearly apparent to me that I need to step up as a dad. And so I thought a lot about that, had that conversation with my wife, and my girls over the holidays, and communicated that to the Prime Minister just a week ago.
Did he ask you, we're coming up to the normal lifespan of a minority government, 18 months. If anyone's not going to run, let me know now so I can put a fresh face on the front bench. Did he ask all of you in cabinet to let him know if you were pondering leaving, and did that prompt you to kind of deepen your reflection?
Not at all. I've been, if anything, I think my conversation with him caught him off guard. And he was very gracious, very kind, and very understanding. He reflected on being a parent himself, talked about raising his kids, also mentioned his father and the role that his dad played when he turned 13, and his dad spent time with him and his siblings. So it was a very personal conversation. He understood where I was coming from. But by no means was it in any means or a reflection of any question he posed or direction he had given.
Is this a signal, and it's hard to read it otherwise, that at least the government is gearing up to prepare for a 2021 election? It is a minority government. There's a budget coming up. Is this the front bench for an election?
Look, I do firmly believe we need cabinet ministers in cabinet that will be running as candidates in the next election. That's why I stepped down as a minister, so we could have new faces. And Omar Al-Gabra from the region of Peel has stepped in, and he's a tremendous individual, so I want to congratulate him. But I also think it's difficult to say with any degree of certainty when the election will be. In a minority government, as you can fully appreciate, the opposition will play a critical role in determining that. And as you mentioned, we're in the middle of a pandemic, rolling out a vaccine. So all those will be important considerations. But right now, the government and the Prime Minister are clearly focused on helping Canadians during these challenging times.
Look, there's been a lot of criticism, and you were at the center of it, of Canada's inability to produce, mass-produce vaccines, as you know, domestically. Many have said some could have done it. Certainly the AstraZeneca at facilities like the National Research Council in Quebec and others, Quebec City. They could have wired, GlaxoSmithKline, who had done the H1N1 and others. Maybe they could have produced the vaccine. This was part of your file. Do you feel that that was a miss for you and for the government in this pandemic, not to have heeded warnings early enough and not to have sort of weaponized our domestic facilities to make sure we could either license and produce other vaccines?
Well, there's 2 points I want to make, Evan. First of all, since World War II, we've never seen such a significant mobilization of industry to build personal protective equipment for frontline healthcare workers. 50% of what we now source for personal protective equipment is made by Canadian businesses. And that's a reflection of our entrepreneurs stepping up, innovators, researchers, and scientists. So that truly is a point of pride, and I'm very glad to be associated with that. And in terms of building up our domestic manufacturing capabilities and our vaccine purchases, we listen to the advice of a vaccine task force, individuals that are experts and scientists that understand this field very well. And that is why we built this robust portfolio of vaccines. That's why we also invested in Canadian initiatives like Medicago, or Vital Intervac, or the therapeutic in Abcelera. So I'm very proud of the investment.
I get that, but we didn't. But it's not going to help us in this particular pandemic. We put our chips on the wrong thing. I'm just like, I know the rearview mirror is always much clearer than the windshield. So don't get me wrong. I appreciate that. But look at you've chosen the rearview mirror and you've ditched the windshield for a second. So now looking in it, could we have done better?
Look, I leave with no regrets, Evan. I'm so proud to have worked with incredible nonpartisan public servants, with the political staff that worked around the clock to help Canadians in this pandemic. We accomplished a lot. The Made in Canada initiative, as I indicated to you, was the most significant mobilization effort since World War II for our industry. And we have a lot more to do. Bottom line is the Prime Minister announced additional vaccine doses that we have purchased. And we need to work with the provinces to roll this out in a timely manner. People are concerned, people are frustrated, people are anxious. And bottom line is we got to save lives. So there's a lot more to do. And I have complete confidence in my colleagues. Francois-Philippe Champagne, who will be taking over my responsibilities, is a very capable individual. And he'll continue to highlight the investments we have made and we need to make, as you indicate, to address some of these issues.
Okay, I'm going to leave you. See if you can, now that you're out of cabinet, I'll see if you can answer a yes or no question. Will you run again at some point?
I have no intention of doing so, Evan. Right now, my number one priority is family.
I don't buy it. I think you're going to be back at some point, but I know I get it. I would just say, and again, I say this to any MP, any member of parliament, we need people to participate in our democracy. It's a tough job. I appreciate you coming in, Mr. Baines, and thanks for being here today. I appreciate it very much. Good luck.
Thank you very much for having me on your show, Evan, and all the best.
All right, that is Navdeep Baines. He used to be the Innovation Science Minister, 17 years in politics, going back to the family. All right, here's what you need to know as well right now. U.S. President Donald Trump speaking in Texas today near the U.S.-Mexico border. He's there to address the partial construction of his border wall, but he began by lashing out at lawmakers who want him removed from office for inciting the insurrection in the wake of what happened on Wednesday. Well, the president was having none of that. Here's what he said.
Free speech is under assault like never before. The 25th Amendment is of zero risk to me, but will come back to haunt Joe Biden and the Biden administration. As the expression goes, be careful what you wish for. The impeachment hoax is a continuation of the greatest and most vicious witch hunt in the history of our country and is causing tremendous anger and division and pain, far greater than most people will ever understand, which is very dangerous for the USA, especially at this very tender time.
Yeah, it's the impeachment stuff that's causing the division, not the insurrection that killed 5 people on Capitol Hill. The FBI and the U.S. Department of Justice revealed the stunning scope of its investigation into last week's riots. More than 170 people have been identified. 70 have already been charged. The acting U.S. Attorney, Michael Sherwin, says he expects hundreds of criminal cases to emerge from that attack. We're going to take you to Alberta. Are we going to go to Alberta right now? We're going to take you to Alberta right now. Our officials are providing an update on the COVID-19 in that province. Let's go to Alberta.
Response. We continue to prioritize contact tracing for other cases involving minors or those working or living in continuing care or other congregate facilities. With more contact tracers and fewer cases, we are reducing the number of cases with unknown exposures. Currently, only about 47% of our active cases have an unknown source. This is down from about 80% on December 10th to 15th. It is important to note that investigations into recent cases are still underway and that identifying a source of exposure is complex. Even with a fully functioning system, there are always a portion of cases, usually around 30%, where the source of exposure cannot be identified. We are making progress, and we will continue to build our capacity. Turning to today's numbers, over the last 24 hours, we have identified 652 new cases of COVID-19 in the province and completed about 9,300 tests. That puts our current positivity rate at about 6.8%. Schools have resumed in-person classes. Right now, there is currently 1 school on alert with a single case. There are currently 819 people in hospital, including 132 who have been admitted to the ICU. Sadly, 38 new deaths were reported to Alberta Health in the last 24 hours. We must always remember that these figures are not just numbers, but lives. Every death involved somebody who was loved and was loved by many. My thoughts go to everyone who is mourning a loss of a loved one from any cause. Yesterday, we expanded immunization to include paramedics and emergency medical technicians. This comes after AHS started offering immunizations to healthcare workers in all COVID-19 units, medical and surgical units, and operating rooms last week. I want to thank all healthcare workers for their work and for signing up as soon as possible to receive the COVID-19 vaccine. You have done remarkable work for many months, serving on the front lines, often putting your own health and well-being at risk. Being immunized will help protect patients and slow the spread of COVID-19. And importantly, it will help protect you, and you are a vital part of the team. I also want to thank Albertans for being patient as we are rolling out the vaccine. We are rolling out vaccine as quickly as possible and every day seeing more and more Albertans immunized. As we get a clearer picture on the number of vaccines available, we will be able to make decisions on phase 2 in the coming weeks. I know that a great many groups would benefit from this vaccine, and we will continue expanding our approach as more vaccines arrive. In the meantime, we must all continue to make safe choices and follow public health measures to reduce the spread of COVID-19. Thank you, and I'm happy to answer your questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Our first question comes from Kevin Mimic from CTV. Your line is open.
Hi, Dr. Hinshaw. 2 questions for you today. In terms of COVID-19 deaths, do you believe 2021 will be even more deadly than 2020? And also seeing today some businesses choosing to open against provincial rules. What sorts of punishments would you like to see for these businesses? Today we saw that they were forced to close, but they weren't given tickets. Do you think that all businesses that open against the provincial rules should be forced to close?
Thank you for the questions. First of all, it is my hope that 2021 will see many fewer deaths than 2020 for the reason that we do have vaccine and we are prioritizing availability of that vaccine to those at highest risk of severe outcomes. However, it is critical that until we are able to offer that vaccine to everyone at that high risk, that we do continue to work together to protect them, which leads directly to the second question you asked. Part of that protection and part of preventing those deaths, preventing our healthcare system from being overwhelmed, is all of us, including business owners, making choices that support our communities. I recognize that business owners are being impacted by the restrictions and that these are causing hardships for many individuals. I also recognize that if we do not have an approach that involves all of our community members working together to prevent spread, we risk having more deaths and increasing that burden on our healthcare system. So what I would say is important is what I have always said.
All right, that's the latest update from Alberta. But let's get back to the Ontario situation because they've just declared not only a state of emergency, but a stay-at-home order for 28 days. Dire predictions from new modeling says in the worst-case scenario, by February, ICUs will be overwhelmed. Worse, there could be more deaths in long-term care homes in this second wave than in the first wave, which was awful. Bleak new figures suggest daily COVID deaths could, again, worst-case scenario, double from 50 deaths to 100 a day. By February, there's a new variant of the UK COVID strain, and that is making things worse. So bad news from Ontario today. Will the new rules actually make a difference? Are they consistent? Why is there no support for long-term care homes? Why is there no sick leave? What's going to happen here? The press gallery is going to weigh in. Bob Fife from the Globe and Mail is here, the bureau chief there. Emily Nicolas, columnist with Le Devoir. She's living through the curfew in Quebec. We'll get an update on that. And Dr. Isaac Bogosh joins us. He's also on the Ontario COVID-19 Vaccine Distribution Task Force. We appreciate his work on the front lines. Great to see the three of you here. Doc, I'll start with you. Let's just start with the latest modeling. It's pretty bleak winter. If things are so bad and if those predictions are so bad, are the measures taken today enough?
Well, I think they're going to help. I'm not sure if they're going to be enough. Certainly, anything you do that restricts people from getting into contact with other people and expanding that on a mass scale will certainly have some incremental benefit. I think what's unknown is how much incremental benefit will that be. I think the other thing that you pointed out very wisely was, what are the upstream drivers of infection and how can you prevent that? And certainly, you hit the nail on the head with paid sick leave. We know that there's some workplaces that are just, there's just outbreaks associated with them and people can't afford to not go to work. So they go to work sick, they infect other people, and then everyone gets sick at work, and then they go home and infect people in their families and amplify the infection. I think paid sick leave would have been an extremely valuable tool here. We didn't get that, but we did get other measures like closing down many sectors of the economy, like in construction, limiting gatherings to 5 outdoors, and that's really supposed to be with your family so you can get outside and get some exercise. The stay-at-home orders, non-essential retail closing earlier. So there certainly are measures to restrict contact, and it probably will help to some degree. I'm not quite sure how much, though.
Yeah, Bob Fife, you watched what's going on in Ontario, and I'll get to the federal government getting 20 million more doses of Pfizer. Theirs aren't going to come to Q2, so they'll have literally, good, I guess, but they're going to have no impact on this. What did you make of the measures that Ontario took today?
Well, I think you hit the nail on the head. We are going to see a rise in deaths and a significant spike in COVID infections, but the measures unveiled by the Ford government are restrictions that are full of contradictions. You can still have weddings of 10 or less. You can the businesses largely left untouched other than, how many people go to get groceries before at 7 a.m. or after 8 p.m.? Very few, I would imagine. It looks like the most significant thing is that they've extended schools for 2.5 weeks, the closures of schools for 2.5 weeks. But it looks to me what this is more is a sign of saying, look, we're trying to do something. But the restrictions are really not that significant, it seems to me, particularly when we have this new, very highly transmissible variant that we don't know what effect it's going to have in spreading throughout the province. So I'm not overly impressed by what the government has done in Ontario.
Yeah, with those predictions about long-term care home deaths being worse in the second wave, I was just surprised there was nothing done for that community. Now, I just don't know where that goes. Emily, let me get to Quebec. You're in the current lockdown situation. Ontario is now all worried about enforcement being at the discretion of police. You can get fined. Apparently, you can go to jail for a year. No one seems to know for what exact violation. How's the lockdown and the enforcement working in Quebec?
Well, there's been people who were, very obviously trying to play with the rules, or people who were protesting the curfew who have been given fines. But I think the more worrisome element is people who are just homeless, basically also being given fines. There's some cases of that in Montreal, but also in Val d'Or. And that's where there's a lot of people coalescing, basically asking the government to reconsider the impact of the curfew on homeless people. And just generally, just the fact that we got there, it's people who live in really small apartments, women who are living violence at home, who cannot escape. Those are the people who will be the most impacted by a curfew like that. So it's just, there's a lot of outrage, both on the right and the left, actually, in terms of what are the impact of such a stark restriction of civil liberties.
Yeah, that's one element. You got the security threat to our health, and then the civil liberties encroachments. Doc, what was your reaction to the federal government's announcement today that they've purchased 20 million more doses of Pfizer? Again, on the volume side, they seem to be overperforming. On the speed side, does this make any difference in terms of quickly vaccinating more Canadians so we can get the heck out of this situation?
Listen, Evan, I'm always going to be excited at the prospect of more vaccine. Yes, of course, we want it right now, but it doesn't look like that's in the cards. It looks like it's spring. And if that's what it takes to ramp it up in spring, so be it. We have a trickle of vaccines now from coast to coast. We see that those vaccines, by and large, are going into the most needy of needy arms. So we see this blitz to vaccinate those who work and live in long-term care across the country. I think that's going to start to have some impact, probably in at least a week or two, when we start to see more and more people vaccinated, even with the first dose. We know that there's some protective effect about 2 weeks after the first dose. Yes, we want 2 doses in everybody, but hopefully we start to see some of the deaths in long-term care at least simmering down a little bit as more and more people in long-term care are vaccinated. But yeah, 20 million vaccines in the spring. I mean, listen, that just means we can ramp up these programs a lot faster, and maybe we'll get to that deadline in Canada where everyone who wants a vaccine is vaccinated much earlier than September.
All right, Dr. Bogoch, thanks for you. Bob and Emily, stick around, and Dr. Bogoch, great to always have you with your perspective on that. I want to get into the raw politics of this next. Is the government with a cabinet shuffle preparing for an election in 2021? And the old saying, it's about the economy, stupid. Is it now about the vaccine and how that goes? Is that the ballot box question in a potential election? So Bob and Emily will stick around, and then we'll bring in Nick Nanos from Nanos Research to give his perspective. So lots to come on the raw politics of the vaccine and the cabinet shuffle next. Stay with us. Welcome back to the program. So amidst a lockdown in Ontario, curfews in Quebec, amidst an announcement that we got 20 new million doses of the Pfizer vaccine, but not coming until April or May, a political shakeup. Navdeep Bains leaves his position as the innovation minister. He's leaving politics. Justin Trudeau decided time for a cabinet shuffle, and we had the first Zoom shuffle ever. And you've got François-Philippe Champagne leaving Foreign Affairs and going to be the new innovation minister. Mark Garneau leaves transport, goes to foreign affairs. Jim Carr's welcome back. He's healthy, good news. He's the special representative to the prairies. And you got Omar Al-Gabra steps into his first cabinet post as the transportation minister. Is this a team ready for a snap election? And if it is, does it all rest on the vaccine process, the rollout? The press gallery's back. Bob Fife is back from the Globe. Emily Nicolas is back from Le Devoir. And let's bring in Nick Nanos, the founder of Nanos Research. Nick, just your read on, is this cabinet shuffle getting ready for an election? And if so, what is the big election question for the Trudeau government?
Well, it's pretty clear that the Liberals want to set the table for a potential election. As a minority government, it makes sense to be ready. But the ballot question right now has to do with not just the pandemic, it has to do with vaccines, the role of the federal government and the provinces. And it's going to be a very dicey time over the next month or two in terms of how well or how poorly Canada jabs that vaccine into as many Canadians as possible. So it's going to be interesting to see whether the Liberals play political chicken with the opposition parties and trigger an election, or whether the opposition parties step down.
Bob, your read on the shuffle today and what it means.
Well, first of all, you and I know well that the Liberals would like to have an election campaign. The only thing, because their numbers, their internal polling show them doing extremely well in Ontario and British Columbia, for example, but there's no way that they can force an election or trigger an election campaign unless most Canadians have the vaccine. That is going to be the ballot box question. If people have not been vaccinated, they're going to be very angry at the government. The second thing, of course, is the economy, but it's the vaccination, which is the number one thing. I think the cabinet shuffle today was an excellent move. Francois Philippe Champagne is a little energizing bunny. He reminds me of Jean Chrétien. He'll do a very good job in industry. I think the business community is very enthusiastic about him, less so about Navdeem Bains because they thought he was slow in getting stuff out the door. And it's great to see somebody like Mark Garneau, who is so solid and level-headed at Foreign Affairs. There'll be no trouble in that department with him. A lot of people questioning bringing Omar Al-Gabra on only because in the transport portfolio, only because the industry is at the crossroads right now with the pandemic, and he doesn't have a lot of experience in the transportation sector, but nonetheless, he has the ear of the Prime Minister. So, look, I think we're into an election. If it's not in the spring, it's going to be in the fall.
Yeah, Emily, two powerful Quebec ministers, Francois Philippe Champagne. Bob called him the Energizer Bunny. His nickname on Parliament Hill is Frankie Bubbles because he does have a lot of energy. But this guy is bubbling out of jobs. I mean, he's done, 4 ministries in 5 years? And, of course, Mark Garneau becomes Foreign Affairs. But what do you make of the moves today? Because, Quebec will play a major role in any election campaign.
Frankly, with the Capitol Hill last week, and the curfew, I think very few Quebecers will actually be following the fact that there was a small cabinet shuffle today. So I don't think it's going to have a huge impact in terms of symbol, just because the news cycle is so packed and it feels like 2021 is actually more intense than 2020. That being said, it's not necessarily a bad move to put Mark Garneau in Foreign Affairs. And the thing about where Quebec is going to go in terms of the next election, when that happens, I think really depends on what the Bloc is doing. So if the Bloc is doing great or not, so it's going to have a huge impact. So there's only so much the Liberal can do, with that shuffle, especially, a shuffle of all men. If that's going to be what you're going to do to signal that you're ready for an election, I don't think that's necessarily the strongest signal. And that got perhaps a little bit buried with everything else that's going on on people's mind.
Yeah, it's interesting. The Green Party leader said that there's no longer gender parity, although it's still 18 men, 18 women. The Prime Minister, if you count him, it's 19 men. Let me just go back to you, Nick Nanos. Because the government announced 20 million Pfizer vaccines. And let's just focus on the main thing, and Emily's exactly right. It's all about the vaccine and the politics of that. For not just the federal government, well, how about for the opposition and for provincial governments? Is it all about the next 4 or 5 months on the vaccine and how they've handled the pandemic?
Absolutely. It's going to be about the pandemic and the vaccine. But here's the challenge for the opposition parties, Evan. The fact of the matter is as Canadians are gripped by the pandemic, focused on the vaccine, the Prime Minister is out there all the time. There's no platform for the opposition parties. You know, the thing is there's just not bandwidth. He's taken all the oxygen in the news, and as a result, he's built up an advantage. So the big question for the opposition parties, how can they re-engage? How can they get profile? They're going to want the House to come back so they can start hammering the government and to make it accountable on the job that it's doing. Because if they don't do that, and until they do that, I would expect that the Liberals are going to continue to have an advantage.
All right, guys, I got to leave it there. Bob Fife, Emily Nicola, and Nick Nanos. Again, I think, Emily, you said it right. We all thought 2020 was over. 2021 is just as busy. And Bob's right, though. Whether the budget triggers an election in the spring or maybe in the fall, it may depend on that vaccine rollout. Great to have all three of you on. That is your Power Play Day in Politics. Thanks so much for watching. It's a tough time out there, folks. We'll be back here in 23 short hours. If you can, and if it's safe, hug your loved ones. Be kind. Have a great evening. We'll see you back here tomorrow.